Dulcie Wanda. I'm a clinical oncologist, meaning I'm a doctor that treats cancer using chemotherapy and radiotherapy. Today we're going to talk about a very important organ. It's small, but it's very important, and that's the tongue. Functions of the tongue, like what I'm doing right now, talking to you. The tongue is what is enabling me to talk, especially when the tongue is free and able to move. Another function, it helps us during swallowing. It enables us to swallow food and be able to get the nourishment from the food. And even enjoy food. You can be able to taste food. You can taste salt. You can taste an orange. You can taste. It helps you differentiate different types of food. And as you can see, I'm very excited about food and the different tastes because I love food. So you can go down to the comment and tell me what food you like, and then we can discuss about food at that point in time. However, back to cancer. How would you know that you have cancer? Majority of the patients come and say it started with a painless ulcer, either a white or red patch that is not wipeable. Like you notice on your tongue there's a white patch or a red patch, or you notice there's an ulcer or a swelling or bleeding from that area. Over time, then the symptoms can get worse, where now you might have pain, you might have mass that is growing on top, which makes the shape become very different. But when we talk about the tongue has two parts. Did you know it has two parts? I don't think you did. So it has two parts. So if I do that is part number one, what you can see as I remove my tongue. That is the oral part of the tongue. There is the second part of the tongue that you cannot see even if I do again, because it's at the back, near your throat. So when cancers happen in the front part of the tongue, it's called oral cancer because it's within the oral cavity, the tongue bit. If it's at the back, then it becomes pharyngeal cancer. So we will have some time to talk about pharyngeal cancer in another video, but today we are focusing on just the tongue, the oral part of the tongue. So for you to be able to swallow, for you to be able to talk, your tongue must be free. There are some children that are born with their tongue fixed, and you have to cut the lower aspect of it to free the tongue so that it can be able to move. For you to swallow, your tongue also needs to be free. So motion like moving to your tongue to the right, to the left, up, down, are all able to do that because your tongue is free. The tongue is made of different types of muscles that are arranged in different ways, and that makes it mobile. And some people have extra muscles like me, and they can do something special. Like I can fold my tongue into a clove. Can you do that? I don't think you could do that. Anyway, back to cancer of the tongue. So if you do notice that you have cancer of the tongue, one of the things that might happen is lack of mobility. The tongue can become fixed to one area, meaning you might not be able to swallow right, you might not be able to talk right, and that becomes a problem because the functions of the tongue are now hampered. So how do we diagnose cancer of the tongue? So one is observation. It's important for you to always look at your tongue. If you notice a patch, a red patch, a white patch, an ulcer that is painless, it's important for you to go to the hospital. The doctor will examine and also take a biopsy so that we can look at it under the microscope to confirm, do you have cancer or not? What are some of the risk factors to cancer of the tongue? One, cigarette smoking. And when we talk about cigarettes, we're talking about the pipe, we're talking about cigarettes themselves. They are a risk factor to getting cancer of the tongue. Two, alcohol intake is a risk factor to cancer of the tongue. Who would imagine alcohol? It's a risk factor. Another risk factor is human papilloma virus. This is a virus we've discussed in the past in some of the videos, especially when we're talking about cancer of the cervix. But cancer of the tongue, also human papilloma virus has a role in its development. So what's the message? If you're a smoker, if you take alcohol, if you engage in sexual activity using your mouth, you're at risk of getting cancer of the tongue. It's important for you to go get screened. Have a doctor look at your mouth regularly as you go for your dental checkup so that we can pick out these lesions in good time. So once a biopsy has been taken, we confirm you have cancer of the tongue. There are several things we look at. One, how big is that lesion? Is it a big lesion? Is it fixed to other areas? Or is it just on the tongue? If it's very early disease and it's just in the tongue, then we do recommend for surgical excision, the surgeon to go remove that area with cancer. So sometimes they'll remove part of the tongue, their tongues, they'll remove all of the tongue, depending on how far the disease has gone. If it is fixed, meaning your tongue can't move, then surgery might not be a very viable option. So in that situation, we might give you chemotherapy, we might give you radiotherapy, and hoping that will be able to clear the disease process. So the challenge when we are treating the tongue, remember we said it has a function in swallowing. So as we focus on treating, either be it the surgery and also the chemo and radiation, you may have challenges feeding. There are times when that happens, we recommend insertion of a feeding tube. We put a tube to your stomach so that food goes directly to your stomach using a syringe as we focus on treating your mouth. Once the treatment has happened and you're able to regain function of swallowing, the tube can be removed. If you're not able to resume swallowing, then the tube will remain there to help you be able to feed. And that really helps patients be able to go through with treatment without loss of weight and remain strong because they're still able to eat despite the treatment. So what are we saying? Look at your tongue. Get your tongue checked. And if there is a lesion, get a biopsy done and let us start treating you in good time. Cancer of the tongue caught early has very good outcomes. It is possible for you to be treated and to become cancer-free. However, the longer you wait, the harder it is to treat. And this information kindly share with your friends if they are smoking, if they drink alcohol, and if they are exposed to the human papilloma virus, then they need to ensure they're getting checked. Check your tongue. And it's important to give your children vaccination. The vaccine currently is free in Kenya. Between the age of 9 to 14, you can prevent your children from actually getting cancers by ensuring they are vaccinated. Thank you. Let's discuss more about cancer in the next video.